Brad Smith, thank you for joining me once again in the land of social distancing. I hope you're keeping well.
I am keeping well, and it's great to see you from a distance of 2,300 miles, Trevor. I think that passes the 6-foot test with a little margin of error.
One group of people who have truly emerged as the heroes of this crisis are doctors. These medical professionals, these doctors are heroes because, they're putting themselves in harm's way to keep everybody else alive right now. You have an organization that you're very passionate about and work with through Microsoft. Tell me a little bit about them.
Well, when you think about it, Trevor, this is a virus without borders. It is spreading around the world. Not surprisingly, one of the most important organizations fighting this virus is Doctors Without Borders. So I'm really thrilled that we're here today with Avril Benoit, the executive director, the leader of Doctors Without Borders.
This is a time unlike any where the entire world is dealing with the exact same crisis at the same time. I don't think that's ever happened in human history before. What are you experiencing as Doctors Without Borders? Because you aren't experiencing it in one place, you're experiencing it all over the globe.
We're overwhelmed, to be honest. This is brutal. We have operations in more than 70 countries. I'm proud to say that our teams all over the world, initially it started with, okay, how can we do the infection control? How can we maybe, check how many supplies of masks that we have? And what can we do to make sure that our own hospitals and medical facilities are going to be safe? And the answer is, it's a problem. We have supply problems, just like we have in some of the hospitals in the US, where you've got medical staff looking at the shortage of masks, looking at the shortage of gowns and all the other personal protective equipment that they would require to be safe in looking after these cases. And then you've got all the other people who rely on our medical services and who are vulnerable. So, just to say it's a heck of a lot of work, and we're on it.
One thing we've noticed is that the coronavirus genuinely has no border. And so it experiences waves from nation to nation. What do you think some of the concerns are that you have as an international organization of doctors that people may not even be considering yet?
Many of the places in the world that we work right now are about to enter the peak season for malnutrition, the peak season for malaria. And it's going to make it very complicated also because we haven't even seen the full dynamic of this virus in many places. This is the combination that we haven't seen yet. And of course, we're being very attentive so that we can pay attention and sound the alarm if we start to see trends emerging in that regard.
Brad, I want to bring you in for a second and chat to you about Microsoft's role in all of this and what tools and resources you feel you've been able to bring to them to try and help them with what they need.
Obviously, doctors in the field need to be with patients, but you've got, Avril, obviously people in offices who are working from home. You've got a supply chain of medical equipment you're trying to manage. So for us to be able to work with you to provide Office 365, Teams, basically the digital infrastructure, we like to think of ourselves as sort of the digital supporters and first responders for the world's first responders. And that's what Doctors Without Borders is. It's a global first responder.
What would you say are the two major areas that your organization needs help with the most?
We're looking to really be able to protect our staff above all, because once they're protected, they can then help others. So in terms of that local procurement of supplies for PPE, that's an enormous help to us. The other thing is, a lot of things are costing more. Do you know that PPE now, for us, for our procurement people trying to get it, costs 10 times more than normal? The price gouging is obnoxious. And we're also having to organize our own cargo planes. We can't just ship it the normal ways, and it's an emergency, so we have to go really fast. Things are costing more, and we really appreciate all the support that we have from around the world. We're privately funded, and so these donations, which people can make to our website, doctorswithoutborders.org, we will make it go a long way and do everything we can to respond to this unprecedented global health emergency.
Well, thank you so much for being on the front lines. Honestly, it's something we've never seen before, and I hope more than ever people appreciate the people who are willing to risk their lives to keep the rest of us safe. So thank you so much for spearheading these efforts.